Okay, well, let's go ahead and get started. I want to thank the organizers for inviting me to participate in this symposium, and I want to apologize for my inability to be there in person, but hopefully this video recording will serve as an overview. And if you're interested in following up, if you have any questions, you can write to me directly at the email address below. So over the next 15 minutes, I'll share with you some of the work that we've been doing in my group around technologies for respiratory health monitoring. I'll begin with an overview, a little bit of a context, and some of the approaches that have been useful for us in this context, and then specifically describe a couple of different sensing platforms for measuring respiratory activity, and provide an overview of some applications that we have and are currently exploring in sleep and in pediatric monitoring. So my affiliation is with Northwestern University. I'm a biomedical engineer, work closely with the clinical community to develop new technologies that can benefit patient care. So a lot of the work that we do is associated with an institute that we have here at Northwestern to facilitate this kind of work, which exists really at the boundaries between engineering science and medical science, with a very strong translational orientation. So we're interested in developing new sensors, but also creating them in quantities that allow us to do meaningful pilot scale studies on patients in hospital settings. So the overarching vision of this institute is to create classes of electronics that are compatible with soft living tissues, in particular devices that offer the levels of sophistication in electronic functionality that are common in consumer electronics gadgetry built on rigid planar surfaces of semiconductor wafers into technologies that have physical forms that are more compatible with the surfaces that one encounters in the human body, the surface of the skin, surface of various internal organs, to enable two-way communication, so stimulation and various therapeutic types of function, but as I'll focus on in this presentation, advanced sensor modalities as well, with sort of clinical grade data streams and wireless streaming to external recording devices. So we and others are quite active in this field, sometimes referred to as bioelectronics. There are by now a wide portfolio of devices of that general type, skin compatible systems that can adhere to various regions of the surface of the body, selected at anatomical locations that are relevant to a particular monitoring function. They can be deployed individually or in multiple time synchronized collections of devices for sort of full body assessments of health status and various kinds of activities. Where there's a clinical predicate, we aim for clinical grade measurement quality, but in a lot of cases, we're also interested in de novo measurement capabilities that align with patient needs. So at this point, as I mentioned, there's a broad portfolio, different types of devices, sizes, shapes, configurations, customized to particular measurement opportunities, and across a wide range of sensor modalities, sort of summarized in this slide: precision thermal capabilities, electrical biopotential, of course, even microfluidic capabilities can be embedded in these devices for capturing and doing biomarker analysis of eccrine sweat, mechanical characteristics, strain, motion, modulus pressure, optical as well. And what I'll focus on in this presentation involves acoustic and mechanical signatures of respiratory activity, also applicable to monitoring of cardiac cycles, gastrointestinal activity, and so on. So each one of these devices can include multiple sensors of these various types, so they're multimodal. As I mentioned before, the aim is in clinical grade measurement capabilities, so clinical quality data streams, but captured continuously and without wired interfaces to external data acquisition systems. And also, strong emphasis of ours is on global health, where cost can be a significant constraint. So we think about cost as an engineering parameter so that these technologies could be available to everywhere, anywhere across the globe, even resource constrained areas of the planet. So we have a large number of efforts around those technologies geared towards specific classes of patients. A lot of our focus is on pediatric maternal fetal health, but broader collections of patients as well at the other end of the age spectrum. So thinking about elder care, and let me start there because it'll give me an opportunity to describe how these technologies are relevant for respiratory health as well. So I'll begin with a device that was designed in response to inbound requests from rehabilitation physicians at a large rehabilitation hospital here in Chicago, the Shirley Ryan Ability Lab. And they wanted to be able to monitor swallowing and speech behavior in patients recovering from a stroke who suffer from dysphagia or aphasia. So these patients come into the clinic, they undergo rehabilitation, and in many cases they show improvements while they're in the clinic, but a lot of those improvements dissipate after they return to a home setting, so that then when they show up for their next rehabilitation session, they have to relearn some of the things they learned previously. So the idea was to be able to monitor continuously swallowing and speech behavior so that data could be used to sort of customize and tailor a rehabilitation protocol to an individual's need, and also to provide that information to the individual so that they can continue with their rehabilitation exercises in a quantitatively guided manner in a home setting. So the idea was to develop a soft device that is capable of measuring high bandwidth characteristics of motions of the surface of the skin at a unique body location, the suprasternal notch, the soft tissue location at the bottom of the neck, where at the interface with the underlying chest cavity. Just a simple adherent wireless device that mechanically couples to the skin at that body location. Now, it turns out you can monitor characteristics of speech due to vibrations of the vocal cords. The bandwidth in the accelerometer unit that we have embedded in this device is broad enough to capture those high frequency motions. But we can also capture much lower frequency characteristics, such as those associated with the swallowing event motion of the neck muscles that are associated with that swallow process. So we can monitor speech and swallowing. That's very straightforward. But it turns out that you can monitor a lot of other parameters at that body location. So, for example, pulsatile blood flow through the carotid arteries can be picked up as motion signatures of blood flow. And from that data, you can determine heart rate and heart rate variability. You're coupled to the chest wall cavity, so you can measure motions of the chest as the patient inhales and exhales. And so from that data, you can determine the respiratory rate. You can also determine respiratory sounds, so wheezing and coughing, all sorts of other parameters associated with respiratory cycles can also be picked up with this device. And then in addition to that, you get a lot of contextual information because you're coupled to the core of the body, and so you can measure body motions, body changes in body orientation, activity level, and so on. So one device mounted at that location can capture a tremendous amount of data with a focus in this presentation on respiratory activity, but with all of the other data streams coming along with that, essentially for free. So we've used this device in the context of monitoring of sleep. And so you get all kinds of cardiopulmonary activity, respiratory cycles, sounds of snoring, even subaudible sounds of snoring, at the very early stages of that process, with just one, relatively unobtrusive device. And so you can wear this during sleep, and we've done extensive studies of this device in sleep labs where we can do quantitative comparisons against data captured with traditional polysomnography systems, which are quite cumbersome for the patient, thereby altering natural patterns of sleep. So this is the idea. Tremendous amount of raw data. We can use digital filtering to separate the various activities that are being recorded. We can separate heart rate from respiratory rate, for example, respiratory sounds from other kinds of body processes, and so on. And then we've developed machine learning algorithms that take all of those data streams and convert them into sleep stages. But as I mentioned before, it's important contextual information because you get body orientation as well, kind of going beyond what's traditionally done with polysomnography systems. So from the gravitational acceleration vector, you can determine orientation of the core body, and you can sort of track that over time during the sleep night. And this is a short movie showing the changes in body orientation during a sleeping period. as you can kind of see that there. And you can do that through an entire sleep night, as I mentioned before, and you can measure, various kinds of characteristics, and that the traditional measurements align with those captured with polysomnography, and then we can use those machine learning algorithms, as I mentioned before, to separate REM sleep from non-REM sleep from wake and sleep cycles. Now, one of the interesting things is with machine learning, we can determine the significance of the various parameters that are extracted from these recordings. As you can see on the right-hand side of this slide, respiratory rate variability turns out to be a really key metric that's typically not tracked during sleep, but very valuable in determining sleep staging in this way. So fairly large number of patients coming through a sleep hospital in the Champaign-Urbana area in collaboration with Dr. Davies, who runs the sleep lab there. So this is what you can do. You can also measure, as I mentioned before, snoring, and you can capture snoring events as a function of body orientation. So here you see snoring appearing in the spectrogram in the lower part of this view graph as wide spectral content. So it's almost like white noise associated with snoring, synchronized with the respiratory phase, as you might imagine. So we're capturing the snoring sounds, but also the respiratory cycles, and you see those two oscillatory features in the data well aligned with one another. And this particular time frame is interesting because at about the 60-second time point, the individual changes their body orientation slightly, as shown in the upper slide, upper graph on this slide. So you see the angle change, and when the body angle changes, the snoring ceases. And so this might be kind of an interesting way that one could prompt an individual to change body orientation to eliminate that snoring event. Sort of what you can do in terms of respiratory monitoring coupled with body orientation monitoring using the same device. The other thing you can do is you can capture sort of what we're referring to as scarcely audible snoring signals. There's a very high precision measurement associated with this device, and so we can capture impending snoring events before they become readily audible, to enable capture with microphone. So this is something that we can also do as a subtle kind of respiratory signature associated with a sleep-related event. But we're also interested, as I mentioned before, in pediatrics and in more detailed assessments of respiratory activity. And so let me give you a sense of our latest work in this area. So what we've done is we've taken the device that I showed you before and added to it very high precision digital microphones, actually a pair of microphones, one facing the body, the other facing the ambient. And we can use sound separation techniques to independently monitor sounds in the ambient and sounds coming from internal body processes. And in that same device platform, we also have this high bandwidth accelerometer, so we can capture motions of the chest wall. We can measure vibratory signatures of respiratory events, but now we can really measure with high precision, all of that very high frequency sound related content, all in a single device that's not much larger than the one that I showed you before. So we've worked with neonatologists at Montreal Children's Hospital to use these devices on infants, so premature infants that in many cases have respiratory difficulties, and we can really monitor now with precision the sounds associated with respiration in these very fragile but precious patients, and we can couple those sound measurements with measurements of the motion of the chest wall, as I mentioned before, and the stomach. They're sort of stomach breathers in many cases, these premature babies. So these results were published recently, and all the details are present there. But the other thing that we can do with these devices, and we're working with lung transplant surgeons in this context, is, as I mentioned before, you can use individual devices for sort of a simple, kind of low burden method for characterizing respiration. But you can mount multiple devices, all time synchronized at different locations on the front, of the chest and on the back. And so now you can measure spatiotemporal patterns of airflow into both of the lungs. You can monitor motions of the chest wall cavities. You really track, how air is flowing into the lungs, and you kind of use that to study patients who've undergone a lung resection, for example, or a lung transplant. Really characterize this sort of respiratory activity in great detail. And so our collaborator here is the surgeon Ankit Bharat. So this is an example of sort of a visualization of both motions as well as sound intensities monitored in that kind of spatiotemporal mapping modality that I mentioned before, providing fundamentally new insights in a non-invasive way around patients who are suffering from various disorders or diseases of the lungs. So that's all I had to share with you. It's about a 15-minute point, and so we're engineering new platforms for monitoring respiratory activity. I gave you a couple of examples in sleep and pediatrics and in lung transplant patients. And we think there's a lot of opportunity for this kind of technology, and I'd be happy to discuss with any of you, some details about these engineering systems, and perhaps even, have discussions around collaboration opportunities. So that's the conclusion of the talk. I just want to acknowledge all the funding from our, institute that's supporting a lot of this work. Acknowledge senior collaborators have been associated with these programs. We're a very collaborative group, interacting closely with our medical community. But the students are the most important people, so I'll kind of conclude my presentation with acknowledgement to them, and with a thank you for your attention and for your patience with my not being able to be there in person. Thank you very much.